Atropine sulfate is a medication derived from the belladonna plant, Atropine belladonna. It belongs to a class of drugs called anticholinergics, which means it blocks the action of acetylcholine, a neurotransmitter in the nervous system. Atropine sulfate has various medical uses due to its ability to affect the parasympathetic nervous system. Here are some common uses of atropine sulfate. Dilation of pupils. Atropine sulfate is used in ophthalmology to dilate the pupils for eye examinations, particularly for conditions like uveitis, where pupil dilation can help prevent synechiae, adhesions between the iris and the lens. Bradycardia. It can be used to treat slow heart rates, bradycardia, and certain heart rhythm abnormalities, as it increases the heart rate by blocking the action of the vagus nerve on the heart. Antidote for poisoning. Atropine sulfate is used as an antidote for poisoning with certain toxins, including certain types of insecticides and nerve agents like organophosphates. Pre-anesthetic medication. It may be used prior to surgery to decrease salivary and bronchial secretions and to counteract the effects of some anesthetic drugs. Gastrointestinal disorders. Atropine sulfate can help reduce gastric and intestinal motility, making it useful in the treatment of conditions like irritable bowel syndrome and diarrhea. Asthma and chronic obstructive pulmonary disease, COPD. It can be used as a bronchodilator to help relax the airway muscles and improve airflow, especially in emergency situations. Nerve agent exposure. Atropine sulfate is a key component of the treatment protocol for individuals exposed to nerve agents like sarin or VX, as these agents can lead to overstimulation of acetylcholine receptors in the body. It's important to note that atropine sulfate should be used under medical supervision due to its potential side effects and interactions with other medications. The appropriate dosage and administration depend on the specific medical condition being treated. Always consult a healthcare professional for proper guidance and usage. Atropine sulfate, like any medication, can have potential side effects. The severity and likelihood of these side effects can vary depending on the dose, the individual's sensitivity, and the specific medical condition being treated. Here are some common side effects associated with atropine sulfate. 1. Dry mouth and throat. Atropine sulfate can reduce salivary gland secretion, leading to a dry mouth and throat. 2. Blurred vision. Because atropine sulfate dilates the pupils, it can cause temporary blurred vision, sensitivity to light, and difficulty focusing on close objects. 3. Increased heart rate. Atropine sulfate can increase heart rate, leading to tachycardia, rapid heart rate. 4. Constipation. It can slow down gastrointestinal motility, potentially leading to constipation. 5. Urinary retention. Atropine sulfate may cause difficulty urinating due to its effect on bladder muscle tone. 6. Confusion and cognitive impairment. In some cases, atropine sulfate can lead to confusion, memory impairment, or cognitive disturbances, especially in elderly individuals. 7. Flushed skin. Some people may experience flushed and warm skin as a result of the medication's effect on blood vessels. 8. Drowsiness. While not as common as other effects, atropine sulfate can lead to drowsiness or sedation. 9. Hallucinations. In high doses or in sensitive individuals, atropine sulfate can cause hallucinations and other mental disturbances. 10. Agitation and restlessness. Some people may experience restlessness, agitation, or nervousness. 11. Dry skin. Atropine can reduce sweat gland activity, leading to dry skin. Allergic reactions. Although rare, allergic reactions to atropine sulfate can occur and may manifest as skin rashes, itching, or swelling. It's important to note that atropine sulfate is typically administered under medical supervision, and the benefits are weighed against the potential risks and side effects. The side effects mentioned above are not exhaustive, and individuals may experience other reactions. If you experience any severe or persistent side effects, it's important to seek medical attention promptly. Always follow your healthcare provider's recommendations and dosing instructions when using atropine sulfate or any medication. If you have concerns about potential side effects or interactions, discuss them with your doctor or pharmacist before starting the medication.